Kim Taylor, I still have you on here. We've got Craig Davenport. Looks like Craig's not here today. Craig, are you on the call?
He resigned.
Oh, that's right.
Oh,
That's right. We haven't replaced him yet. David Lund also resigned. Got Gail Kogel is on the call. Jackie Sowers on the call. Jamie Rosteck. Don't see Jamie on the call. Got Under Sheriff Thompson on the call.
here.
Lita Phillips. Don't see Lita here yet. And Lori Moon. Don't see Lori Moon. Michael Lindsley. We got you here though.
Yep.
All right. And then as far as others, we've got our Leah Parr here. Do we have Kat Nichols on the call? Not today. Ashley McGee. She's here. Jessica Thompson's here. Justin Johnson's here. Katie Rice is here. Tom Gose is here. And then we've got our visitors. Chantal Liskey from NAMI. And then do we have Dr. Velasquez yet? Not yet. All right, so that is roll. Looks like, just confirming here, I believe we've got a quorum here. Is that what you're showing?
Arlie, are you seeing a quorum there?
Yes.
Wonderful. And Andrew, sorry to interrupt. I just wanted to let you know. So we had a last minute cancellation from Dr. Velasquez,
Oh,
unfortunately.
that's a bummer. Hopefully we can
I
get
know.
him here for another meeting. All right, so we do have quorum, so we'll move on to business. Do we have?
Actually, oh, sorry to interrupt. I just wanted to, this is Liz Perez from Community Health Plan of Washington.
Oh, good to have you here, Liz. I guess I had missed, I passed over you. I'm sorry about that.
No worries.
All right, has everyone had a chance to review the minutes? And if so, do we have a motion to approve?
Motion to approve.
All right, thank you, Shane. Do we have a second?
I'll
This is-
second. This is Gail. Sorry, I should just wait. Somebody else is always going to do it ahead of me.
All right, thank you, Gail, for that, and Kim as well. Any other discussion? Hearing none, all in favor of approving the minutes, aye.
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 All opposed or abstaining? All right, hearing none, the minutes are approved. All right, moving on to the agenda, we've got, Justin, are you starting us with our update on the system changes?
Well, since we did have that last minute cancellation, we can definitely start with administrative updates. I think the important aspect, if it's okay, is probably provide some background on what opiate work is being done and maybe some feedback for those who are participating in the fentanyl roundtable. That way we can share a little bit from our perspective. Of course, I defer to Dr. V and all the work that he's doing there, but I know a lot of our team has been actively participating, and we can give a little bit of background on the regional work that's being done, if that might be helpful.
Please.
Excellent. I was actually just looking up, if I am correct, Andrew, well, first of all, congratulations on winning your seat. I want to acknowledge that right now. And then wasn't there a question you had about some of the work being done there? I think I caught one via email. I can't remember.
Right. Well, I was just wondering, I was just looking to get a little bit of information from them on some of the discussions about benefits of being private versus keeping it with the health district and sort of those sorts of things. Just more informational, just a little bit more information on why this is being looked at now. And I understand Spokane County is unique on the way we do it, that other counties don't do it this way, but kind of wondering, are we a beacon that other people should be following, or should we be getting on board with something else? Because I just don't know enough either way.
Yeah, and so I'll answer that real quick from the county's perspective, because our county board comprises the majority of the health district board, and generally they have a lot of sway on that. I'll leave it to Dr. V on the specifics regarding treatment services intertwined with the regional health district. But I believe what a lot of you may have heard is that there are two parts of the regional health district. Regional health district's primary goal and focus, right, is regional health prevention and safety aspects. So they really look at wellness as a whole, and they look at the health specific prevention activities as it pertains to individuals' whole body. It can be anything from, this is common, you've seen the billboards, STIs and impact in the community, but also specific to health and wellness of mother babies, individuals experiencing certain health-related outcomes. So when COVID was hitting, Dr. V and previous medical directors had a lot of say and input on process procedures from a regional health district perspective, but they also do a lot of other work for health awareness and training. The other aspect of the regional health district is treatment services, and this is predominantly focused on substance use related treatment. I think everyone is aware that they have one of the only MOUD or opioid treatment programs, or OTP, in Spokane County. One of the other providers is Ideal Options, but SRHD is one of them, and it is one of the most encompassing programs throughout the entire region, including all of our managed care organizations or Medicaid insurance coverage, commercial and non-Medicaid coverage through the county. So they do quite a bit on that end. And that's just one major aspect of it. They also do a lot of reentry work and jail treatment services as part of it. So the question that has recently come up as they've done public information is, should those two things be separate and spin one of those off treatment services to another provider who could focus entirely on that, and they can focus directly on their mandate as the health regional health district, or to keep it a part of the organization? And again, I will defer to Dr. V. They've been doing a lot of public comment. A lot of this came forward because I think internally they're looking at what is the community and the focus or needs around that. And from a regional health district perspective, does it make sense to continue in this road? Now, not all counties do that. Obviously, substance use prevention and the impact on individuals definitely is a public health issue. And I think that's why Dr. V is championing the opiate or fentanyl roundtable for the impact. But as it specifically means like drug treatment, that's the question that they're asking. So that's kind of the background on this. From the county's perspective, as the regional health board, as on the regional health board, they want to know, does it make better sense to allow them to focus on that and getting that community feedback? Come December 5th, is it? They will be meeting again, or December, don't quote me, it's next week. They'll be meeting next week to discuss continuing forward with exploratory conversations and or to cease them altogether. So there's really two steps here. The board discussing, is this even an option you want to explore? The next step, if they say yes, then the next step would be, okay, what does it look like if we actually did that and began the process? So they're nowhere near at all splitting them off. This was all about gathering information to say, is it even a community or feasible option? And if not, then we'll just cease conversations. So the board will be meeting next week, and they may vote to say cease all discussions based on the feedback. And then it ends there. There's no more movement moving forward to have that discussion, and it remains intact. Or they may say, next steps, which is anything from longer term review to even begin the process. And if they did that, it would still, in the estimation, still require a full vote from the entire health board. And then it would still require a lengthy process to even explore. So I don't see any indication there would be any immediate changes based on our conversations and impact. But again, defer to Dr. V. I'm a poor substitute for his information and background on that. But I think that does provide some, I know a lot of questions have come up, lessen some of the consternation. People may feel like, oh, does this mean we're losing it? No, that's never was the intention. It was, can someone else do it better and expand services? And there are a lot of providers that had interest who said, yeah, we could take that on and we could expand it. And then the second aspect was, could we better serve the community from a health district perspective if we spun that off so we could focus entirely on prevention and public health? And I think that's the questions they'll be answering next week when the board meets. So you should hear more next week on that process.
Oh, thank you, Justin. Shane, do you have a question on that or a comment?
Yeah, I have a couple questions. So Justin, you've always been very progressive in our county that I know of since 2007 on the SOB or on this BHAB. I've been serving and I'm out in the community 5-6 days a week with the homeless at 4 a.m. Okay. So for the last 5+ years. So what do you think we should do? Because we're always in the like top 3 or 5 in the nation because of his progressiveness and Gail over there. So what do you think? Candidly.
So professionally, I defer to our Board of County Commissioners to make their determination. I know. I'm in a unique position where they are solely the represented officials to make that determination. I will say this.
They're going to go solely on what you say. We all know.
Yes. So I appreciate, and I'll be as candid as possible within my position, which is this. I'm always looking 5 years down the road towards how can we better serve the community. So I have presented some ideas to the board to say, if they decided on either option, and the pros and cons, because I like to have those, just like anyone does, what's the benefit, the outcomes. I think SRHD has done a wonderful job providing treatment service to the community. I think that absolutely needs to remain. And I don't think there is any benefit that does not allow for the continued or expanded service that SRHD provides. I'll be frank with you. I think that's absolutely needed. Now, whether or not it's under SRHD, I defer to the board, but that service needs to exist. They're too crucial, especially in the midst of an opiate crisis. I do think SRHD is uniquely positioned right now to provide care in the community. And I would say there would be some substantial information provided to the board for them to feel comfortable looking at other options that could at all put the community at a potential disadvantage. I mean, I'll be honest with you. Whenever we make a change, the last thing you want is the services that individuals are receiving, there's any disruption or they're harmed. So that's what I'm recommending to the board, at any given time, if there's any feedback that there could potentially be harm, that needs to be addressed prior to moving forward. So that's my recommendation. Again, I know that's not more of a vague answer as to what is recommended, but I advise the board that 5 years strategically, there are a dozen or so options that we can look at. And there's more flexibility when there is the board allowing for that future potential than if they were to give it to someone else where they have no control or ability to influence. So I think that uniquely puts an elected official in the seat of, do they want to hand off authority?
I think maybe we should have this conversation when you don't have to be political. So what I've found over the last 17 years or more in this field is that less bureaucracy and efficiency seems to work much better in the private sector. I'm just going to say that. Okay? I think you danced around that topic.
Yeah? I think that regardless, so long as I have the ability and the board has voting control, we'll continue to serve the public to the best of our ability, and we'll enhance that serviceability. In fact, I'm really excited to have background conversations in the next 5 years to say, how can we better expand MOUD treatment to ensure more expanded and rapid deployment of opiate use disorder treatment in the community and medication-assisted treatment. So those conversations are ongoing, and SRHD is a wonderful partner to that goal.
Our peer support services on the street, reaching the people, doing preventative care, it's harm reduction, and it's evidence-based outcome. It's all proven to save money and be more effective. You know that. So, yeah. so here's what I have to tell you guys. Okay, as I'm out there 5-6 days a week, and Frank, that was selling all the dope for the gypsy jokers, that running all the fentanyl and the opioids downtown, is running from the feds right now. So it's wide open, and there's a whole bunch of wild new people from out of town. Okay. And the kids are ODing like crazy. I have had to hit them with 2-3 times and they're dead for 2-3 minutes. Okay. And it's happening on a regular basis. There was 3 this morning. Okay. Under Stevens and Howard. So, it's a big problem. It's a big problem right now. There's a lot of crap out there that is not coming in pure, and they're getting the powder for $20, and they're getting the pills for $1 a piece, and they never know if it's full of the crap that causes flesh-eating diseases, or if it's an OD, or it's absolutely nothing. Okay. And the best place I can get them to right now is the recovery cafe that they're willing to go to. And that's 20-30 people every morning that I'm personally talking to. So if anybody ever wants to go down there, you're welcome to show up down there. Okay, that's what I see on the street every single day. So,
And I appreciate that feedback.
and I'll
Justin, this
tell
is
you
part of why I
that,
wanted it on here. So I wanted to just get a
Yeah.
little bit more info, and hopefully we can have this more coming up. Gail, you've got your hands up, so we'll go to you, and then Shane, we can go back to you if you've got more after Gail.
Thank you. I just wanted to make the comment and to follow up. In my capacity acting as ombuds, I can tell you that I do get calls from people who have had adverse effects because something happens, their dose has been cut, their carries have been maybe brought up to dailies or whatever, and it is very, very hard. And I can't imagine what it would be like if the lead-in time is all I can think of, is how that would be managed by another organization who doesn't know these guys, and to transfer over the case management or the therapy sessions that they provide. I'm not saying I'm for or against the change. I'm just saying I would like to be really sensitive to the people, all the people that they're serving. Some people have been going there for almost 15 years, according to the last couple I worked with. So that's a long tenure.
yeah, they can't sustain it. They can't do it. They can't go without. There's no way.
Mhm.
It's asking too much. And the police and the cop shops are really the prevention thing, are really our number one people on the street, you guys. Interventions. So they're right there on the street being social workers, not just cops.
Do you have
That's
other
all I got.
questions or comments on this topic?
Ask that question again, please.
Oh, just asking if we had other questions or comments on this topic about the health district's current exploration on moving their treatment services outside.
I think my question is is there anything I can do to help?
Justin?
At this time, like I said, the vote next week with the Regional Health District Board is going to be giving feedback. Again, we're not even anywhere near the conversation of even moving forward. So I think there's been plenty of feedback in listening sessions. And I will say the board's going to have to make, the Regional Health District Board's going to have to make some real difficult decisions, even if they want to proceed with it. And what I've heard, and I think maybe everyone's kind of felt this, that there's substantial concern about making any changes right in the midst of the current treatment needs that exist within the community. So I can tell you this, I've gotten a sense from both individuals on the board as well as the health district. I think there's a desire to want to continue the amazing work that they've been doing, but also look into the future as a constant look for quality and future-oriented business planning as to whether or not this makes sense. And for right now, the sense I get is it does make sense to continue. So I don't know which way the board will vote next week, but I would say it would take a lot for them to vote to proceed forward based on the information they've already been provided.
Should we be emailing and giving them input, or just staying out of it at this point, Justin? They got too much information already.
They've done quite a bit of listening sessions, and so they've been inundated. In fact, they've had a lot of people call them directly. So I think the Health District Board meetings, I don't even know if they are public, but it might be something for those, if it is, just to listen in on their meeting and kind of because they're going to vote on whether or not to proceed. So we can definitely provide that out if individuals are interested, if we can find that.
And that those meetings are open. You can go onto the health district's website and get the information on where they hold those in the building and when they are, and you're welcome to attend them. But Justin, I definitely whatever happens next week, I hope keep us updated. And then if they do proceed to move forward with exploring this further, hopefully we can get someone in here from the health district just to talk about kind of where the planning process is and going, and some of those, just like you said, there's a lot of people here who've got concerns about any transition if it does happen being done right.
Definitely. And as a reminder, the Behavioral Health Advisory Board on behalf of Spokane County provides advice to the county commissioners. Currently, Josh Kearns and Mary Cooney sit on the Health District Board. If in the future, the BHAB as a voting member wanted to send a letter expressing that, that is something that the BHAB can do. Of course, it would have to go through your guys's Robert's rules to see if you're in the majority, would you want to support that? And then, of course, how it would be written, what it would say. But again, your advice and feedback can definitely be provided to the board because that is this role, an advisory committee. Just wanted to throw that out.
I appreciate it. All right. Well, I think we've had a good start to this conversation. Let's move on to the next agenda item, which is the youth respite and expanded inpatient.
So to get us started on the administrative updates, we've made a lot of progress on some few things. So I'll let Ashley and Jessica talk about the youth respite, but I did want to give an update just on what we've been doing with the opiate dollars and Spokane County's focus. I think this is really important to understand kind of what's being done, because we hear a lot of narrative in the community about there being a crisis, but not a lot about what are we rapidly looking to deploy. So I just wanted to remind everyone here that Spokane County was the only municipality that started out doing the initial work for the review and dispersing the funds within immediately receiving it. So July 1st of 2024, and then we knew this in 2023, we began doing community feedback and reviews that immediately was sent out. And so we did an exhaustive review. We've got collection of individuals with expertise, which include many members from the BHAB, as well as community experts, and from the SHROF, the opiate task force that was already convening by the health district for, I think, 3 years prior. And then we also took an internal review based on the service we provided. And then the board voted on dispersing out some $2.2 million. And I've given a lot of updates on this, so I'm going to go over this really quickly, at least for the major updates. But Spokane County immediately implemented those. And we have yet to still hear on what the plan is for the city. So this is just the county's work that does serve the city. The city is looking to release more information. I believe they are convening next week to talk to providers on what they plan to do with their opiate dollars. But as of now, the county has one of the largest shares, so we wanted to put this money out. One of the major ones was putting out funding to develop long-term strategies to address the opiate crisis. We can put out a ton of money now to deal with the current need. What about 5 years down the road to ensure that the impacts, there's sufficient and necessary infrastructure and services available to treat individuals? And the board approved for the development of a crisis relief and sobering center, the first of its kind in all of Eastern Washington, and truly one of the first in the entire state under this new statute for this facility. We are heavy involved in building out this facility. That will bring on board at minimum 24 beds to allow for walk-in immediate service. This is crucial because we don't have immediate walk-in unless you go to the ER. And even then, we all know it may not be immediate unless law enforcement drops you off. This would allow individuals to be referred by a community member or just walk in, and they're required to take up to 90% of all law enforcement drop-offs. That facility we hope to have come online at the end of 2026, early 2027. We're building a brand new, and we're going to have co-located medical services, psychopharmacology, and ability for peers to walk them from the relief center to an inpatient facility, hopefully on site there with the stabilization, withdrawal management, and co-occurring. The goal there is to bridge that gap, reduce unnecessary hospitalizations, and ensure connection for ongoing care. That's the immediate care, but we have to build that brand new. The other investment was developing and investing in a triage and sobering services now. So Spokane County awarded through procurement and I appreciate everyone who supported us in that procurement review. Many of you on this call on BHAB, STARS, which is using their Cali location. The board also voted as a part of a joint partnership with the state of Washington Department of Commerce to help them purchase the building. Currently, they're just renting it. They're in a 3-year right of first refusal lease with Daybreak, who is the previous owner. The facility is already licensed to provide services, so it's advantageous for them to own that. By Spokane investing dollars to purchase it, not only do we ensure withdrawal management services for all of Spokane County and the continuity of those, we ensure that STARS is successful and we can build out the sobering. So if I don't know if anyone's has visited the Cali location, we're going to be renovating the entire basement to do sobering. In the future, potentially residential services, and then in the upstairs, withdrawal management. Again, further expanding out immediate care. That is already live. We're working on implementing that. A soft go launch for some of the beds is slated for next week, but they had to hire all the staff. So that's what we've been doing for the last month. And then we'll be looking at helping them purchase it. I've also been in talks with the city to look at partnerships with their opiate dollars to say, okay, this serves a lot. Put money in and we can even build this out further. And so they're very open to that because the county's put a lot of money down. That could mean even further beds for immediate care. Here's the benefit of this. STARS is already connected with multi-care clinic. They're getting same-day appointments for MAT treatment and opioid treatment, same day. So the moment someone goes in, they get that care, and then they're immediately connected into their withdrawal management or referred to another provider. The triage services allow for behavioral health and mental health services as well. So although we may not convince an individual to continue down the road of traditional health, this allows for that direct connection. That's what we're doing right now. In addition, in conjunction with the Sheriff's Department, the county has, and Under Sheriff Thompson knows this quite well, is looking to go further upstream in a preventative model to say, what are we doing with the data that we are receiving or seeing on the streets, and how can we better target so we can do more prevention? And to Mr. Lindsay's comment earlier, there's been a lot of disruption. And that does not mean it goes away. It just means new actors go to fill spaces. And this is how the Sheriff's Department can focus and target much more succinctly so that we do not continue to have those actors that come forward. And there's more partnership, not only with them, but with the health district to target data specific to opiate use. And not just who has unfortunately died from overdose, but how many have we actually treated, brought back from the brink, and now are back in the system that we don't track. That's part of what the Sheriff's Department is looking at doing, is saying we are leading the way in ensuring that all comprehensive services are connected. And then we also gave some money out to neonatal abstinence syndrome facility, Maddie's Place, to look at long-term transitional housing. Right now, when a mom gets released who is taking care of an infant, and actually family members as well, so guardians, which can include the father, if they're released, they're often going back to the home in the community or some sort of housing first option. We all know housing first has been very beneficial to getting individual off the street, but it's not always conducive environment to remaining in sobriety, especially when you have a young newborn that causes a lot of stress. I've got 4 kids. Kids and stress go hand in hand. And oftentimes when you experience that, right, you go back to old coping mechanisms. If you don't have really strong ability to have a wraparound community. Maddie's Place is going to be building out, with the investment from the county, housing to do transitional housing support for long-term engagement. Not only that, employment support, and most of the individuals there for family reunification have been so successful that DCRF cases, I think they said 80% of those have been resolved to allow for the families to remain with their kids and to continue to be reunited with other kids that may have been separated. Very successful. We want to continue that amazing work. Again, looking at the impacts, and that's a twofer. I don't know if any of you guys, Black Friday coming up, a 2-for-1 deal is always the best kind of deal, and that's what we're getting with Maddie's Place. So great investment for every dollar spent. And then we're also using mental health sales tax dollars as well to invest heavily in the community. And one of those areas is the use of mental health sales tax for a wide bevy of intervention services. But one of the biggest ones, strategic to opiate use, really, and substance use, is saying how much further can we go upstream to attack where we're seeing an impact with youth. That's an area where we want to get them before they start turning to substances like fentanyl or any opiate to say they're self-medicating challenges. And so our $2 million investment into SBIRT has been so successful that we've got more schools clamoring. We don't have enough money to put that out. 6 schools, the data we're seeing is right on par with the challenges we're associated, and we're providing that, again, regardless of insurance coverage. So these kids are getting treatment services funded by the county when their own insurance may or may not even cover them. That's huge. We're bridging a gap right now that was not covered previously, and we're seeing hundreds of students. We're on track to hit 1,000 students engaged that would not have otherwise have been if we had not started this program for school year 2025. So amazing success, and I'll let others talk about that. But these are upstream preventative models that we're looking at, as well as building out immediate service needs. And we're also looking at other partnerships, which include expanded MAT treatment and opiate treatment with SRHD. So I don't want to talk more about that until we land some things, but anyone who needs that is turned away from walking in to get an appointment for MAT treatment is a person that has the potential for going into overdose, and that's what we need to prevent. I want no one turned away. So we're looking at using more of that to expand out same day walk-in for people that need that, so we can do more preventative care. So that's just a quick update on the county's work. I know we're dealing with 5 years and greater of harm that communities have experienced from opiates, and we're still experiencing it. But as we look towards now and a comprehensive array of intervention points and 5 years down the road, Spokane County is leading the way, not only in conjunction and partnership with our law enforcement officers, but also with the city, by the way, that we are still partnering. You may have heard otherwise. The county is looking to seal a partnership with Co-Response, where we're paying for their firefighters and joint behavioral health providers to go out and do street engagements through the fire department. We're going to be the first in Eastern Washington to do this, and the county's funding it entirely. That is huge, and we're doing so through Spokane City. So, Ms. Lindsay, to your point again, on the street, a lot of the involvement is with our law enforcement who has been doing that. We need to get our medical team on board, and they can do medical clearances. So we'll be starting that here at the end of the year and funding the city and supporting them in that effort.
Can I ask you 3 quick questions?
Yeah, I know there's a lot. Sorry about that.
Number 1 is the new facility, the beds, are there going to be the 4 beds or more hidden for Sacred Heart or any of the emergency rooms that when they come in through the emergency rooms? That there's always beds for Sacred Heart that nobody knows about unless you are in the inn? Or is that going to happen with this new facility too?
The facility, Crisis Relief and Sobering Center, will be available in all beds to all Spokane County residents with no special assigned or set apart beds, other than specialized rooms for individuals that need some quiet time as they await evaluation for ITA. We will be allowing certain space set aside for just those individuals per the statute. We have to provide that, but otherwise, the milieu will be an open home-like setting. We don't want to be restrictive, and we want all individuals welcome to come without setting apart anyone specific to a unique funding and or a group with certain anticipated aspects like hospitals.
Because when STARS is full, you have to ask and know somebody, is there still 2 beds for Sacred Heart? And you can maybe get in through Sacred Heart.
That is where Spokane County, by taking lead on this, we get to have, from a county perspective, a greater leverage to ensure bed availability for all.
Okay. And my other thing is they're having a hard time getting the locks in on the street when they're going into the facilities there, and the emergency rooms are telling them they can't have it. They won't hand it to them anymore. So what's going on there? I'm going to talk about that. And
Yeah.
three, I would like to have input when you start to interact with 911, because they have a policy that when they wake up, if they're running, which everybody does after they get hit with that adrenaline, that they drive away and they do not stop and chase them. If they will stay for 5 minutes and talk them down, they could help them. It has happened several times to me that 911 is pulling up and I wake the person up with naloxone on the second or third hit, and they drive right by.
And to that point, the whole development of the specialized behavioral health co-response unit is to, first of all, not have a major fire engine being taken offline, lights flashing, terrifying people, but to have
And
a specialized
cop,
unit.
and an ambulance and a hook and ladder. I mean,
Yes.
a grand just rolled by.
Yeah, no, what we hope to have is our sheriff's department go out and do a lot of the initial work, because they're being called out to these with the BHU unit already in place. Do a warm handoff to medical, which will just be a dispatched unit, not full lights, but just a paramedic and a behavioral health provider who will work with them to transition them into either care, the hospital, or to sit there for a while and ensure that they're cleared in the field. That's the goal, to work in tandem with the work that's already being done by our wonderful sheriff's department, but at the same breath, to ensure the medical component and that there is someone there. This has two benefits, right? They're there, they get to talk to somebody, and often people are more apt to listen when they're talking about their medical health than another aspect of it. But it also frees up our sheriff's department and police units to return back to active duty and to respond. So freeing up units to be more responsive.
Okay, so the county is supposed to be finally voting on the cop shops funding next week. So everybody, please contact your commissioners and your county people, because they're trying to cut the funding or eliminate it. And I think we should be handing out the naloxone and having these people in the street feel comfortable to interact with the cop shop with some retired officers that don't cost us a dime except for the gas of the car to drive instead of 150 grand. Just makes sense to me that we should fund our cop shops and build relationships with these people. It's outcome based, evidence, science, it's all backed. That's all I got.
All right, that is a lot of updates, Justin, but all of it, that's amazing. Hearing all those things tracking in the right direction there, so thank you. All right. Ashley and Jessica, looks like we're finally ready for your update.
Yes.
Thank you.
Thank you,
I got a
Justin.
soapbox this week, sorry.
So the next update I'll talk about, and I'll let Jessica touch base on the youth respite program, but first I'll talk about the expanded inpatient 350% FPL and what that means. As Justin indicated, we've been looking at where services are being provided, how they're being provided, and how we can expand the scope of services that are being provided. So currently at the Spokane Regional Crisis Stabilization Center, there's 3 levels of care that are being provided. There's mental health stabilization, there's co-occurring inpatient, as well as withdrawal management services there. And the ASO specifically funds individuals who are non-Medicaid at or below the 220% federal poverty line. But with commitment from the Board of County Commissioners and local sales tax dollars, we're looking to expand that to allow for populations of those individuals that fall outside of that 220% federal poverty line up until 350% federal poverty line to be covered for those services, as we want to ensure that that scope of service is being provided to those individuals and that insurance isn't a barrier to getting access to that. So we're looking to initiate that change in the beginning of this new year, which is an exciting endeavor with the Spokane Regional Crisis Stabilization Center. And hopefully we should be able to get some more data to kind of talk about what impact we're seeing from expanding that scope. And I'll pause here if there's any questions on that part. Not seeing.
I'm just going to
anything.
say bravo.
Thanks,
It's a
Gail.
great program.
Yeah, definitely want to make sure that more individuals in Spokane County specifically can have access to those needed services. The other local dollar project that we're also working on currently that just went live last week is Youth and Adolescent Behavioral Health Caregiver Respite. And I'm going to go ahead and turn it over to Jessica to talk a little bit about what that is and what we're hoping to achieve with that.
Thank you, Ashley. As Ashley indicated, we are excited that we currently have a request for proposal open, which opened effective November 20th for youth and adolescent caregiver respite services. This is a service that we used to have back when we were the behavioral health organization for our community that provided planned youth and adolescent caregiver respite options. So providing an opportunity for families to have a place, a safe place for their youth to go so they can have somewhat of a break and to encourage families to have that time so they can attend, appointments and such, as well as have that time to ensure that they can remain the primary caregiver in that sit in with their family so we can keep families together. Respite includes several different things. It's provided in a trauma-informed environment with trained specialists who can provide coordinated lessons, games, and social activities that are psychologically as well as emotionally and developmentally appropriate for the youth and adolescents. That is, and these services are all supervised by a mental health professional. With this, we are hoping to bring back this vital service in our community so we can continue to provide another avenue for services for youth and families and bridge any gaps that we're seeing. This is something that the community has voiced we need back, that even at a state level, this is a needed service throughout the state, not just in our region. And we're hoping to be able to provide this in Spokane County. The ages are going to be 10 to 18 for this service. And with 48 hours per month per youth being available, which is similar to the model that we used to have. This RFP is open currently, as I indicated, open on November 20th and closes December 18th. We're really hoping to get some good applicants, good proposals, so we can start to provide this service in our community in the upcoming year. Any questions on that? Ashley, or anything you'd like to add? Anything I might have missed?
Just want to clarify, it's 10 to 17, and as Jessica indicated, a therapeutic environment for the youth to be at, while also providing respite for not only the youth, but the caregiver as well, to help them sustain in their community and versus having to escalate to more higher intensity level supports.
Thank you, Ashley. Any other questions? I don't know what I said for the ages, but I meant 10 and 17. Sorry
I
about
think
that.
that's what you said. I think that's what you said. I can't remember what it used to look like. Is this to provide a place for the youth to go to?
Yeah.
And get that break away from the family, give the family a break too, so that they can re-energize themselves. So we're looking for somebody who already has a facility, or somebody who is it going to be a home? Or we're just waiting to see what the RFPs look like.
We're waiting to see what the RFPs look like, Gail. Within the RFP itself, it indicates that these services can be provided within, a behavioral health agency or a facility, or even in home, depending upon the proposals that we receive.
Okay, thanks.
Any other questions about this exciting service? This is one that we've been working for a while and are very excited to provide to Spokane County. All right, with that, I will turn it back to you, Andrew.
All right. Well, looks like the next item on the agenda, handled that. It's like a board chair and co-chair election, or vice chair election. So that'll be at our January 27th meeting. So if you're thinking about running for board chair, please let the committee know. If you're looking at running for vice chair, please let the committee know. I won't be able to continue on as chair next year because I don't know if I'll be able to even attend meetings with my schedule. Certainly, I can be a member, but doesn't do me any good as a member if I'm not able to attend meetings. So that's kind of up in the air right now, but I'm pretty sure I won't be able to attend enough meetings that I could reliably serve as the chair next year. So looking for someone to step up to that come January. We'll get that voted on in January. So just something to keep in the back of your heads in the next couple months. All right, did I miss anything on the administrative updates? Get everything, Ashley and Jessica?
Yes,
Um,
I believe you did. And we'll try to reschedule Dr. Velasquez for update on the fentanyl roundtable for our next meeting as well.
All right, I appreciate that.
Absolutely.
All right, well, with that, we'll move on to Tom and the Consumer Consultation Panel report.
I have here my minutes from September and October. First, we'll do September. At this meeting, our guests were Kaylin Roy, liaison to the BHASO and CCP, Gail Kogel, the Office of Behavioral Health Advocacy, and Chloe Axett, intern for Spokane County. Brent Smith, CCP chair, facilitated the meeting. Also attending were CCP members Tom Goes, Aaron Smith, Robin Segner, and Sophia Alexander. Sarah Lee had an excused absence. The online September 24 CCP meeting is called to order. The August CCP meeting minutes were read and approved. There was no August 2024 Behavioral Health Advisory Board meeting, so this was not reported on. Discuss the CCP budget. The CCP may purchase new t-shirts with CCP staff member on the back of the shirt. Sarah Leak will follow up on this. It was noted that CCP has approximately $183 left in its budget. The CCP then discussed new old business. It was noted that Gail is moving to a new office on 312 West Sprague. She's waiting for office furniture to arrive and then she will move in. Brent suggests that we have the December CCP meeting at Gail's new office so we can have our Christmas celebration. Sophia suggested the CCP acquire applications, pass out at Evergreen Club or other places. Gail said that we should try to inform prospective CCP members what the CCP is all about. It was noted the CCP felt the Evergreen Club run went well. It was mentioned that CCP possibly have sports teams mascots at the next Jaunt in June, a walk-in event put on the CCP. However, an air-conditioned room and a bathroom will be required for the mascots. Robin said that the CCP Facebook page is doing all right. However, the CCP posts pictures of a person. This person will have to sign a release saying this is okay. We discussed the coming CCP Santa pictures. We decided to do Grinch photos along with Santa pictures. Planning the pictures at Brent's Church, Ottoman Methodists, at Garland and Driscoll on December 7th. We can hand out Jaunt and June flyers and Jaunt and June flyers at the Santa event also. It was meant the Jaunt tries to remove the stigma of mental illness. It was mentioned that Brent should be sent a reminder in November to do a trial run on his computer to prepare for the Santa event. The next CCP meeting will be held online on Monday, October 14, 2024 from noon to 1 p.m. Meeting was adjourned. Here's my minutes from October. At this meeting, our guests were Kaylin Roy, liaison to BHSO and CCP, Ann Simmons, an observer, and Rose Plorty, a possible new CCP member. Brent Smith, CCP chair, facilitated the meeting. Also attending were CCP members Tom Goes, Aaron Smith, Robin Segner, Sarah Leak, and Sophia Alexander. Gail Kogel had an excused absence. The online October 24 CCP meeting was called to order. September 2024 CCP meetings were read and approved. We discussed the September 2024 Behavioral Health Advisory Board meeting. At this meeting, there was a presentation about the Mobile Recovery Cafe, part of Community Enterprises by Eric Hood. It is called a pop-up cafe. The cafe started in February 2017 and now has 300 members. Eric has been a Spokane Recovery Cafe member since 2019 and is now the Spokane Recovery Cafe manager. There are 70 nationwide recovery cafes. Eric mentioned that Newport, Washington Recovery Cafe has been well received by this community. Eric said that the recovery cafes may expand to other counties and rural areas. There was an administrative update. Ashley McGree reported on Spokane County opioid funds. She said that the county may have funds to build a crisis and sobering center. This will take time. The county also is working on an immediate sobering trade service. There's funding for housing support for caregivers with infants with substance abuse problems. It was noted that the Spokane County Sheriff's Department has good opioid treatment. There was a crisis system data dashboard report by Jessica Thompson. Reported that in quarter two, April to June 2024, there were 308 high utilizers, 10,676 regional crisis hotline calls, 5,402 individual serves, and 20,396 total service provided. There was a crisis system update by Ashley McGee. She said that the Department of Health has received 988 information in Washington, and anybody can receive services. She mentioned that there are mobile rapid response services, and that crisis teams are there to respond. There was ISW, Institute for Student Wellness, update by Jessica Thompson. This serves 7 schools in Spokane and 5 school districts. All schools will begin screening. The ISSW is working on improving its program. Things are going well. Gail Cole said that she's going to focus on child mental health services for the next OBHA meeting. Also, Behavioral Health Advisory Board member Craig Davenport said that he has resigned. The CCB then discussed its budget. The CCB may purchase new T-shirts with CCB staff member on the back of the shirt. The CCB has approximately $183 left in its budget. Under new old business, it was noted that Gail is moving to a new office, which has a boardroom available for CCP meetings. We discussed the coming CCP Santa and Grinch picture event. Brent said that he has bought a cable so the printer and laptop can be wired together. The event will be held at Brent's church, the Audubon Methodist Church on Garland and Driscoll, on Saturday, December 7th, 2024, from 1 to 3 p.m. The CCP should arrive by 11 a.m. Aaron will play Grinch and Palm will play Santa. Brent will print the flyers for the event, and Brent should be reminded in November to do a trial run on his computer to prepare for the event. Rose Plorday then introduced herself as a possible new CCB member. She said that she is in Special Olympics bowling and that she will pass out Santa flyers to the Special Olympics participants. Rose said that she's also called Barbara, but prefers Rose. She said that she is a good organizer and has volunteered to Spokane. She wants to bring creativity and mental health with a jaunt in June to walk an event put on CCB. She said that she meets problems head on and is able to commit to the CCB for a year. She also said that the Special Olympics may want a booth at the jaunt. Rose was voted in as a CCP member. The next CCP meeting will be held online Monday, November 18, 2024 from noon to 1 p.m. Meeting is adjourned. Those are my CCP minutes.
Thank you, Tom. Any questions for Tom? Okay, moving on to board comments, public comments. Anyone else have anything to add before we leave here today? Well, I guess I'll just say happy Thanksgiving to everyone. I hope you have a good Thanksgiving and good rest of your holidays there. And we'll see each of you January 27th at our next meeting.
Sounds good. Thank you.
Have a
All
good
right.
Thanksgiving,
I want to
everyone.
thank all you guys
Thank
for all your
you.
service for the
Happy
year.
Thanksgiving.
Really appreciate all you're doing in the community, everybody.
Thank you.
Thank you.
Thank you.
Happy Thanksgiving. Thanks, everyone.
And you.
Thanksgiving.
Bye.